Hi, I'm Dr. Carole Keim. Whooping cough is a serious disease and can actually be deadly in young children. Children who are less than a year just don't have strong enough muscles to cough, and they stop breathing instead. So please look for the signs. It starts off just like any other cold, but the cough lasts for much longer. If you have a child with a cough for more than 2 weeks, it might be whooping cough. If you or your child knows anyone who's had whooping cough, this is also a sign that they might have it too. If it's treated in the first couple of days, your child will actually get better faster. But if you don't catch it in those first few days, usually the cough will last about 2 months. Even if you think the cough isn't that bad, I still advise you to get antibiotics. Why? Well, because you don't want your child to spread it to other people. It's very contagious. And with antibiotics, the bacteria is killed and you're not contagious anymore. To prevent whooping cough, you and your child should get vaccinated against it. And most kids who get it will get it from their parents or their grandparents. So if you have a young child at home, please make sure that your Tdap is up to date. If you think that you or your child might have whooping cough, please give me a call. I can test for whooping cough at home and prescribe antibiotics. Also, I can come to your house and give you the whooping cough vaccine if you'd like to prevent it. You can call me at the number below.
When going to the doctor just won't do, doctor at your door is there for you.